So welcome, welcome, welcome. Yes, my name is Gretchen. I am a senior education manager with SkinCeuticals. And as Natasha said, yes, I have been in this industry for 25 years, which is insane. I can't think of anything else that I would do besides work in the skincare industry. Actually, no, I tried to get out a little while ago. I became a real estate agent. That was terrible. My first open house, though, I did sell some moisturizers and some hyaluronic acid to some of those individuals that were looking at the house, but I couldn't sell a house. So I'm super excited today to be here to just talk to you a little bit about antioxidants and why we use antioxidants in our skincare regimen, the importance of antioxidants. And then I'm so very, very excited to introduce to you our brand new antioxidant, which is known as Silymarin CF. And I'm going to give you all of the incredible details on that product so you understand what's in it, what's it going to do for you, and the results that you can achieve by utilizing this incredible, innovative new antioxidants that's been launched by SkinCeuticals. But I always like to start this off and ask you, what is your favorite? This is going to be a poll, and we're going to be popping up some polls as we go through this. But what is your favorite SkinCeuticals product? Is it E Ferulic? That's mine. Within a layer of HA intensifier, and then with a layer of triple lipid restore 242. But I would start with the E Ferulic. So I'm going to do the poll, and I'm going to submit E Ferulic. So incredible. Love E Ferulic. E Ferulic is primarily the gold standard. 57% of you love E Ferulic. And this is why this is the gold standard of antioxidants and vitamin C serums. And you know, when you look at a lot of the incredible brands that are on the market out there, you know, a lot of these skincare brands were started by dermatologists. So you have these incredible dermatologists working in their practices and feel, you know what? I'd really like to start a product line. You know, my patients are asking about X, Y, and Z, and I want to fill that gap, or I think I can make a great line, which we have some incredible skincare lines out there. Whereas ours is like that, but just a tad bit different. Whereas we were started by a dermatologist. His name was Dr. Sheldon Pinnell. And Dr. Sheldon Pinnell primarily was a Duke University professor. And he was training these incredible future dermatologists how to diagnose diseases and disorders. And he also was really, really curious about skin cancers and how primarily subjecting the skin to UVA and UVB radiation, how it can cause environmental damage to the skin. And the challenge is that Dr. Pinnell really didn't think about the vitamin C angle until he was in the kitchen with his wife. Every good conversation and good party is in the kitchen, by the way. And she was cutting up apple slices, and she kept taking those apple slices and placing them into water. And that made him question, well, why are you throwing or taking these apple slices and put them in the water? That doesn't make any sense. And she's like, oh, there's not water in this. It's lemon juice. I don't want my apples to turn brown. And that is oxidation, is what we're seeing. And so Dr. Sheldon Pinnell understood oxidation, and he understood vitamin C. But the challenge at the time, and this was in the 90s, is how do you actually utilize vitamin C within a product so it can actually absorb and do what it's supposed to do. We have to remember that the skin is the largest organ of the body, and its biggest job is protection. And for the most part, a lot of products actually sit on the surface of the skin. You've got to find a way for them to absorb into those top layers. So that's what really kind of compelled Dr. Sheldon Pinnell to go a little bit further and study vitamin C's. And he actually was the first person to pioneer on how you can have vitamin C absorb into the skin. And basically there's 3 parameters that you're looking for when you're going to purchase a vitamin C type of product. And first and foremost, you need to utilize an ingredient called L-ascorbic acid. L-ascorbic acid is the active form of vitamin C. Now there's derivatives that are out there. You got your THDs, your magnesium ascorbophosphate, your sodium ascorbopalmitates, and all of these types of elements. Whereas they're going to sit on the skin, but they don't convert back into active L-ascorbic acid, which is the end conversion, the active form of vitamin C. So he found a way to use pure vitamin C, L-ascorbic acid, to really bring a profound change. He also used high percentages, anywhere from 10 to 20% of L-ascorbic acid in a formulation, so you would maximize the concentration and have the full potential of that ingredient in the product. And then lastly, he made it on the acidic side, and our skin is naturally acidic, and he wanted it just below the acidity level of our skin. And then the last thing is that he wanted to make sure those three were the parameters right there. The other element that was super important to him is that the other antioxidants that he added in to the formulation also worked synergistically with the vitamin C and with the other antioxidants. Oftentimes people will see a product and it's got like 25 different antioxidants in the formulation. And the challenge is not every antioxidant is compatible with one another. There's not always a synergy. And sometimes some antioxidants can compete with each other and some can actually render some inactive. So we only use a handful of antioxidants together in a formulation because we understand the synergy that goes together. So when we use pure L-ascorbic acid, we always combine it with ferulic acid because L-ascorbic acid can oxidize somewhat. So ferulic acid, what it helps to do is it helps to support and stabilize that vitamin C so it remains effective in the formulation. He also formulated with Phloretin, Silymarin, resveratrol, and also Glycolic and vitamin E. And all of those antioxidants work together. And the reason that we use an antioxidant is that first and foremost, we want to use antioxidants for environmental protection. When we look at the aging process of the skin, aging is 10% genetic. So thanks, mom and dad, or another thing to, talk about in therapy from your parents is that genetic 10% of aging, but 90% of the aging that we see on the skin many times comes from the environment. And the environment is UVA radiation, UVB radiation. It is also IR, which is infrared. We've also got pollution in the environment. So antioxidants have a great ability to help to give you that environmental protection that you're looking for. They also prevent the aging process. And, one of the biggest things is that when you want to, if you're concerned about aging, prevention is key. And, I was talking to someone earlier today, and they said, when's the best time to start treating your skin? And it's like, as soon as possible. Like you can treat your skin for aging in your late teens and your early 20s. And the prevention is key in helping slowing down that aging response on the surface of the skin. And then also vitamin C specifically itself gives a really great brightening capability to the skin. Even if you're not trying to treat discoloration, maybe that's not a challenge for you, but you want an overall brightness. The great thing about our antioxidants, and specifically L-ascorbic acid as a vitamin C, is that it can also bring a brightening capability to the skin. So when we're looking at antioxidants, one of the most important things when we're using an antioxidant, and specifically that of vitamin C, is that it should be used during the day. So what you're going to do is you're going to cleanse your skin, you're going to tone your skin, and that's when you're going to apply about 4 to 6 drops of the vitamin C serum into your skin. And the great thing about vitamin C serums and antioxidants like our vitamin C serums is that once you place it on the skin, they're going to absorb rather quickly and they're going to remain within the skin. So it's not like you can wash it off. Once it's in, and it's going to give you that around the clock type of action. And, the reason that we're using, vitamin C, and Dr. Sheldon Pennell's biggest reason when it comes to environmental damage is that when we subject ourselves to the environment, the natural reparative process of the skin, it's enabled because the skin's got to focus on the damage that's done. and the repair process. And so there we start to see some detriment. So by adding in a vitamin C, the vitamin C gets to take the abuse in a sense, and then the skin can do what it's supposed to do, which is naturally repair itself. So we can see the incredible element of what antioxidants have. So just to see if you were listening, why do we use an antioxidant in our routines? So that's going to be our first poll question. I like the last one. I'm going to answer it. There are no wrong answers, except for maybe it's a fat. So perfect. So antioxidants, people always ask, what's the exactly environmental protection? We have a bunch of smarties here. I love it. So when we're using an antioxidant, people always ask, what's the number one product that you should use? So we all know the number one anti-aging product is sunscreen. But did you know that when you utilize one of our vitamin C serums along with the sunscreen, you have 8 times more protection than just by using a sunscreen alone? So this is really going to give you that 24/7 around the clock type of capability to, exactly as Natalia said, to prevent and protect. It is key in taking care of your skin. So now the biggest question that we have is, which vitamin C is right for me, right? Because we do have a multitude of vitamin C serums, and each one is designed for a specific skin type as well as a specific skin condition that might be, a challenge or a goal or an expectation that you have with your skin. So for instance, we'll start with what everybody loves the most, which is E Ferulic. So E Ferulic is right here. This is the gold standard of our antioxidants. Again, it's a 15% L-ascorbic acid with a 0.5% ferulic acid and a 1% alpha tocopherol, which is pure vitamin E. And this is going to be great for the individual. It might be you might be like, this is for me, who is concerned with the signs of aging and just an overall brightness and clarity to the skin. And also someone who might be just a little on the drier side. And dry skin is lacking oil for the most part, that you're missing that oil in the skin. Dehydrated skin is lacking moisture. And we're going to be talking about that a little bit more, how we can treat, like we could possibly have breakouts, but we still have what we think is dryness, but it's actually dehydration. So by adding that vitamin E with the E Ferulic into that drier type of skin, which would be me, is going to be a perfect way to prevent the signs of aging and giving that overall brightness. So if that's your concern, you've looked in the mirror and it's mirror on the wall, there's my mother after all, then E Ferulic is going to be a great antioxidant for you. You might have challenges with aging, or you're starting to see the signs of aging, but you also might see some discoloration at the same time. And discoloration can come from so many different types of sources, right? So discoloration can come from the sun, it can come from fantastic hormones in our body, it can come from trauma in the skin, and it can be very, very pesky to treat. So if you're more concerned with the discoloration and want the anti-aging effects, then that's where we're going to recommend something like Phloretin CF. Phloretin CF, great for normal, oily, combination skin as well, but really, really focuses more on that discoloration challenge within the skin. And it's really going to give you that overall brightness. The great thing about Phloretin CF, it's a 10% L-ascorbic acid with a 2% Phloretin and a 0.5% ferulic acid. It comes in 2 different types of forms. Now, I just showed you the serum, which is great for more of that normal to oily to combination skin. We also have it in a gel. I don't have the gel here with me, unfortunately. I'm in San Diego. I'm normally in San Francisco. So that is going to come in a gel form. And that gel form is better for people with that sensitized type of skin. We love the Phloretin CF gel for men. It's a really great post-shave product as well. And a lot of men tend to get that inflammation and that discoloration underneath their neck area from shaving a lot of times. So this is going to be a great way to kind of prevent that. And then lastly, it's like drum roll, please, we now have an antioxidant for your more oily and congested and acne prone skin. And it's like the big reveal right now, and it's Silymarin CF. So Silymarin CF has been a work in progress, and it took us really 7 years to get this formulation perfect for all of you. And basically, even Dr. Sheldon Pennell, when he was studying, antioxidants, Silymarin was one of his most favorite ingredients to use. Actually, we have a product that already had Silymarin or has Silymarin in it, which is, excuse me, our antioxidant lip repair. That was Dr. Pennell's one of his favorite products because he loved Silymarin. So what is Silymarin? Silymarin comes from the milk thistle plant. So if you've ever seen a milk thistle plant, it's basically this beautiful green, full of water type of base, and it's got this gorgeous purple flower. And we know when we see this beautiful brightness in nature that we know that it's going to be full of antioxidants and something called bioflavonoids. And bioflavonoids are just so incredible for our skin because they help with capillary permeability. They help with just cells communicating with one another. It's an incredible ingredient to use bioflavonoids in a product. So the thing about milk thistle is when you have milk thistles plant, you have to extract something called silymarin from it. And that silymarin is that active form of the ingredient of the antioxidant that's found in the milk thistle plant. And the great thing about silymarin itself is that not only can it help have a antioxidant protection, but it's incredible for inflammation. And I know if you're listening to this and you're suffering from acne, you know that inflammation is a real challenge when you have, breakouts on your skin. So treating inflammation really with any skin type, if it's discoloration, aging, acne, you should always look to treat inflammation first. And that's why we use the 0.5% Silymarin, just because not only does it have an incredible antioxidant capability, but it's really, really great at helping with inflammation within the skin. We also combine Silymarin with a 15% L-ascorbic acid. So it's got the same percentage of L-ascorbic acid like E Ferulic does. Then we also added in that ferulic acid to really just maximize the environmental protection, as well as keep, like I said before, that vitamin C stable within that product so it doesn't oxidize. Now, don't be concerned. Let me throw this out there. If you get a product, if your antioxidant, when you first open it, has a light straw color, then that eventually gets a little darker and amber in color. It's a natural process that takes place. The vitamin C is still effective within the product because that ferulic acid is the ultimate wing girl, and it's supporting that vitamin C and that stability so it doesn't oxidize very quickly. And then the last thing that we added into this antioxidant was a 0.5% salicylic acid. And the reason why, and we're going to talk about a little bit like how acne happens, but basically salicylic acid is really good at giving some gentle exfoliation, but it also addresses the bacterial issue in that pore or in that follicle that's basically having a party in the follicle. So with Silymarin CF, it's going to be more for that oily, congested and acne prone skin. So just to recap real quick, we've got E Ferulic, which is great for normal, dry, aging skin. We've got Phloretin CF, which is great for aging and discoloration. And then we've got Silymarin CF, that's really good for more aging and oily prone skin. So I'm going to toss out a poll real quick just to see if you're listening. What part of your routine, let me make sure I get it right. What step in your morning routine should your antioxidant always be? Cue the poll. I'm just going to answer them because I want to. I love it. You guys are listening. Perfect. So then when we look at Silymarin CF, besides the fact that it's designed for oily skin, what is it about oily skin that kind of makes it different than other types of skin? So when we have oily skin, the challenge is that when we subject it to environmental stressors like UVA or UVB radiation, IR, pollution, all of that, the challenge is that there is something that takes place which is called lipid oxidation. And basically lipid oxidation is a breakdown of the lipid portion. Because you have oil in your skin, it's a breakdown of the protection that you have within your skin. Our skin has its own natural antioxidant capability. And when you have an oily skin, an acne prone skin, you tend to have less of that less of that natural antioxidant protection because the oil's oxidizing the skin. The best way to think about lipid oxidation is like, we know when we cut open an apple that it turns brown. A good way to think of lipid, either peroxidation or lipid oxidation, is when you leave butter on a counter and it starts to melt a little. That's lipid oxidation. So within our clinical studies, and SkinCeuticals does clinical studies on final formulation, and we do it on that of human skin, we found that we can reduce oil oxidation in oily skin individuals with Silymarin CF by 76%. And that's an incredible element to really help to treat oxidation and oxidative stress within the skin. So 76% of a reduction in oil oxidation within the skin. And so when we look at Silymarin CF is, again, it's still an antioxidant. It's still designed to primarily, it's there for the treatment to prevent against fine lines and wrinkles. It's there to reduce some of that oiliness that we talked about, and can also minimize poor appearance. So it's going to have all of these different types of elements to really help to treat your skin. So when we're looking at Silymarin CF, what we're going to do, again, you're going to place it on your skin. You're going to press it into your skin after you cleanse and tone, and then you're going to apply your Silymarin. From there, that's where you can layer your other SkinCeuticals products. And so when we're looking at SkinCeuticals, the best way to utilize SkinCeuticals is in a layered fashion. And the question always comes up, well, which product first and how do I layer them? And when we look at layering products, you always want to do antioxidant first. And then when it comes to viscosities or texture, you're always going to go lighter to heavier in viscosities. And then always think, moisturizers are going to be like that lid on that boiling pot of water. They're going to kind of seal everything in. And then your sunscreen during the day is going to be like your last element, because it's going to provide that external type of protection as well. So it's super important to understand that when you use SkinCeuticals and why we have so many serums, it's a layering process. So say you're on here because, acne is your challenge, and inflamed acneic skin or oily skin, or maybe you're even suffering from that dreaded maskne that's going on right now. So your Silymarin CF is going to be the antioxidant of choice. After that, what you're then going to be able to use is your blemish and age defense. So blemish and age defense really targets the 4 contributing factors of acne. And the reason that we get acne a lot of times is that we have a buildup of skin cells. So we have skin cells that are just piling up on the surface of the skin. And what they do is they start congesting the pore. That's when we see blackheads. Blackheads are the first type of lesion that happens. Then they can lead into more inflamed lesions. So every single pimple and every single cyst starts at a blackhead. That's why people like myself get into the industry, clean out blackheads for a living while you're in the treatment room. So that way we can prevent against that happening. So the first and foremost, the buildup of dead skin cells is the first challenge. The second challenge is that we have an influx of oil. So now we've got this cap of skin cells, and then we've got this oil that's producing underneath of that. And so what that's going to do is give a really great environment for bacteria. And then once this bacteria starts having a party, that's when we start to see the inflammation manifesting. So when we're looking at blemish and age has LHA in it, and LHA is a form, it's called lipohydroxy acid. It is related to salicylic acid, and how it's just going to evenly normalize the cell production within the follicle. Then we're going to use an ingredient called dioic acid that's in there, and dioic acid helps to minimize and reduce the production of oil. And then third ingredient that's really going to target some of those contributing factors is the salicylic acid. Salicylic acid not only will help with some of that buildup of dead skin cells in the follicle, but it's also going to kill the bacteria that's having that party, stopping that party within the process. So basically, one thing that I want you to know about when you get Silymarin and when you get Blemish and Age, is going to come in a box like this. And basically what you're going to get is this normal top here with a separate dropper bottle. So basically, when you get this, if you're starting to travel again, or say you just met that new person and you're starting to bring over all your products to their house and start leaving it around, we do suggest that you keep this top right here. And primarily when you travel, take this dropper off and put this top on. The reason why we say that is because salicylic acid, because of the mechanism of action, can get into this little dropper part and make it hard for you to get the product out. So we want you to make sure that you can maximize the product and basically get everything that you would need from this. So I did see a question that somebody just said that Blemish and Age can be drying. So here's first and foremost, it is an active form of exfoliation. So whenever, when I work in the treatment room or when I work with clients, I always take whatever the label says and look at it a little bit more objectively. There is no one size that fits all. And then if you're starting with an exfoliant, it's good to start off progressively and then work your way up. So it could be that, on the bottle it says use twice a day. Maybe you start using it just once a day and see how your skin responds to it. And the important thing to do is when you're using hydroxy acids or when you're using any type of exfoliant, remember that you definitely need to use some type of hydrator on top. The definition for exfoliant is any agent that removes dead skin to reveal a fresher, newer skin underneath. And sometimes that newer skin might not have the hydration levels that it needs. So we're kind of left a little bit more dehydrated than before. So if you're experiencing any kind of dehydration, what you would want to put on top of that product would be one of my other favorite products, which is hydrating B5 gel. Hydrating B5 gel is key for that quick drink of water to the skin. And basically, if you have oily prone or acne prone skin, one of the challenges is that your skin doesn't necessarily function properly, and we tend to overdo it. We tend to overwash our skin sometimes, or we tend to over dry and strip our skin a lot of times, and that actually kind of perpetuates the situation. So by adding in some type of humectant, like hydrating B5 gel, which is hyaluronic acid that acts as a humectant to bind moisture to the skin, or it has also provitamin B5, which is panthenol, that's just going to give you that quick drink of water to the surface of the skin. So it's key. And the challenge is if you have oily or acne prone skin, that you don't always want to feel a weight of a moisturizer on your skin. So basically what you're going to want to do is use something that still hydrates your skin, with just a lighter viscosity. I did see a question just pop up. Is Silymarin different or better than Blemish and Age? They're completely different products. So just to let you know, Silymarin is not an acne treatment product. Silymarin is a preventative vitamin C serum that is designed for acne prone and oily prone skin. Blemish and Age is literally an acne fighting product. It is treating acne on the skin. So they're very, very different. And a lot of times people will ask me, well, what's one product? If you have a challenge with your skin, if it's discoloration, aging, or acne, it's not a one-step process. There's a multi-channel type of step that's going on within the skin. And sometimes you have to address it with different types of products to target the different types of contributing factors that are happening within the skin. So that's my biggest take on that one, is that that's going to basically, kind of lost my train of thought there. Going to be the best way that you can utilize those type of products. So just remember, Silymarin CF is designed for acne. It can help with some of the inflammation, but if you really want to treat some of those underlying contributing factors, you would need other types of products. So I'm quickly just seeing how much that you all remember. So I did speak about Silymarin, and Silymarin CF is clinically demonstrated to reduce oil oxidation by what percentage? I'm going to do it just to see if I get it right. Here we go. So 76%, 68% of us for the win, 76%. And that's a really great type of percentage to see how we can bring down some of that oil oxidation within the skin. So moving right along, when we're treating acne and oily prone skin, we also, again, we've got the hydrating B5 gel that we want to use. And then you might want to use an additional product that also is not just going to serve as a moisturizer, but it's also going to give you a nice brightening and tightening type of effect. And that product is going to be Metacell Renewal B3. Metacell Renewal B3 is an emulsion that has, instead of oil, we use glycerin. And glycerin is non-comedogenic. It's just going to give you a veil of hydration on the skin. But one of the kind of like unique elements of Metacell Renewal B3 is that it has B3. And B3 is niacinamide. And niacinamide is a huge ingredient that people are talking about now. We've been using it for a while. Niacinamide targets not only some of the inflammation associated with acne, but it also, pardon me, it also will treat some of that discoloration that can also be associated when you have inflamed breakouts within the skin. So Metacell Renewal B3, lightweight emulsion, is also going to help with that acne prone skin. And then at night, you have a different type of option. At night, you want to maybe you'll forego using your blemish and AH, and you could start with a retinol. So retinols are great for treating acne prone skin and oily prone skin as well. Retinols will help to really just increase cell renewal. One of the biggest challenges with acne has to do with the buildup of dead skin cells. And so if you can start to normalize that cell production and even out the skin, you can see less congestion. It's going to be great for blackheads. It's going to be great for dilated or open pores. And it's going to be great at really also preventing the aging process at the same time. The thing that we want you to know about retinols is that there is an adjustment period that has to take place. So don't be surprised if when you utilize a retinol in the beginning that you get a little irritation from it, or you get a little flakiness from it. It's 100% normal. It's that adjustment phase that you're going through. So that's why when we use retinols at SkinCeuticals, we have a saying which is called low, slow, and low. So you're going to start off with a retinol 2 to 3 nights a week, and you're going to start at a low percentage if you've never used one. So great thing about SkinCeuticals is that we have 3 different types of retinols. We have 0.3, which is great for new retinol users. We have 0.5 for more, more moderate, and then we've got 1.0 for you diehards that have already been using retinol and have acclimated well. And the thing is how you know when to adjust to go up to a new retinol is that when you can, if you're using 0.3, retinol 0.3, you use it 2 to 3 nights a week. You can do 3 nights a week. You can do 4 nights a week. If you can do 5 nights a week and tolerate it and not have any kinds of challenges, then you can move up to a 0.5. Same thing goes with the 0.5. You start off slow and low, seeing how your skin acclimates. When you can use 5 nights in a row, then you can increase the retinol 1.0. So those are the way that you use retinols. Now, some of you might be a little apprehensive about using a retinol because you do have to go through the adjustment phase, which Triple Lipid Restore 242 really helps that adjustment phase of retinol. You might want an alternative. So that's where I'm going to recommend something like Glycolic 10 Renew Overnight. It has glycolic acid. It's going to give you that brightening to the skin, and it's also going to resurface your skin as well. So those are going to be some different types of options that you would have within using a retinol or a glycolic acid product. So basically, we've discussed our antioxidants. We've discussed also our hydrating B5, so hydration. The last thing I'm going to talk about, we talked about Metacell Renewal B3, which is a great emulsion. It's got that niacinamide that I spoke about. It's going to give you that brightening effect to the skin. Metacell Renewal B3 is also a really good makeup primer, a little FYI right there. And then we talked about at night being able to kind of resurface the skin with either a retinol or with a glycolic 10. If you want to forego using your blemish and age at night, use your blemish and age during the day, and then you could use your glycolic or your retinol at nighttime. Another thing that's really important to do, and especially if you have maskne, and this is something that, Dr. Schlesinger and I, spoke about a little bit a while ago about, just the challenge that comes with acne and wearing a mask right now. And he gave one of the greatest pieces of advice that I've ever heard. And primarily said one thing, he was like, if you tend to break out, don't forget like to change out your mask quite a bit. And also he's like, rinse your mouth out with like a Listerine or some type of antibacterial mouthwash. Because if you're prone to acne lesions, that's from bacteria. And we're just kind of recycling and recirculating that bacteria. So giving yourself just a little bit of a bacterial kill to the breath and to the mouth will help a little bit. It's also important to treat your skin as well. And self-care is super important. But one of the things that you can do to treat just all over, even that specific area, is clarifying clay mask. Clarifying clay mask has kaolin and bentonite in it, which are green clays. They're going to absorb excess oil from your skin. What they're going to do is give you a mattification, but they're not going to dehydrate your skin like some other types of products would. Green clays are great at just absorbing oil and not taking moisture from the skin as well. And this also has some mixed fruit acids in it. So if you love to be like a little mad scientist at home, one thing you can do is you can take your clarifying clay mask and then you can mix in a couple drops of your blemish and age defense. And what that's going to do is going to heighten the effects of the hydroxy acid in that product. I'm having a little bit of maskne right now. Normally I'm at home, but I'm kind of traveling a little bit, so I have to wear a mask a little bit more. And so I've just been doing the clarifying clay mask in the jawline here, adding in the blemish and age, and that's really helped because I got a doozy down here. It's got a little bit of a pulse. I can feel it as we talk, and that's starting to cut down the time that this blemish is actually on my skin. So those are some really great little tips that you can do to treat some of that inflamed breakouts in that area, absorb the excess oil, and treat some of the inflammation as well. So clarifying clay mask, great mask. And the thing is when we talk about masks, you can multi-mask. So you don't necessarily need a clay mask all over. Maybe you just need it in the area where you have those breakouts or that oil. Maybe you have a little bit more dryness on the cheek area and you love a product like our phytocorrective mask, or you have a little dehydration on your neck or on your cheek areas, and hydrating B5 mask is going to be the perfect mask for you. So you can multi-mask as much as you like. Okay, so we talked about our antioxidants. We talked about primarily the hydration, Metacell Renewal B3 as well. We now understand the difference between blemish and age and how we can use it in different ways. And then we also know, please moisturize that skin and a way that we can treat the skin. So I know we're kind of coming on the 45-minute mark. So just one last retention question before we get into the Q&A session. And here we go. This is like my mom would say. She'd say, put your thinking caps on right now. Which does not apply to Silymarin CF? Improves the appearance of fine lines, reduces oiliness, minimizes poor appearance, or provides hydration. Which one does it not do? Good job, people. It doesn't. It's not. So again, when you're using something for hydration, that would be something like your hydrating B5 gel, your Metacell Renewal B3. Hyaluronic acid is key. A moisturizer to seal it in can also, like I said, be that lid on that boiling pot of water. So I'm going to now pass it over and be able to take some of your questions from the lovely and talented Natasha.
Oh, that was amazing, Gretchen. Thank you so much.
My pleasure.
I was thinking many points during listening to you. I was like, it is very evident all of your experience that you have had in the field. So that was fantastic. Thank you.
Thank you.
Okay, so we do have a few questions that have come in, both a few that were before and during the session. So first one I want to get to, it's sort of a general question. I'm wondering if you could give us some tips for speaking to specifically treating chin and jawline concerns. I know you just talked a little bit about the maskne thing, but Suzanne had a question that I thought was really exceptional because frankly, that's one of the things that you don't even think about until it starts to go.
It's a challenge. So this area, there's like different philosophies, and this area has a strong hormonal link for the most part. Ever notice like one side, you like 1 month you break out this side, and others, you know, in certain types of like Eastern philosophies, you would line that up with the ovaries, and an egg comes out of an ovary every single month, and that would allude to that hormonal element of the skin. So it can be a little bit more challenging, and the challenge is that specifically with more adult type of acne is that you've got this persistent redness along with the dehydration that's associated with it. It's like that blemish lasts even longer than when you were a teenager. It's like it used to go away in like 5 days, and now it's like sitting around for 15. Kind of like you used to be able to party till 4 o'clock in the morning and then go to bed and wake up and rally at 8 a.m. and go to work. Metabolism, right? So it gets a little challenging as we age. So one of the biggest things that I would recommend is to treat that oily or that area would be to obviously cleanse the skin. Something like LHA toner. LHA toner is a really nice product to kind of, when you take your mask off or during the day, if you have this challenge, just to take that LHA toner, put it on some cotton rounds into a plastic bag and just wipe your skin down just to remove some of that bacteria from that area. My other huge suggestion is don't pick. I know it's so tempting, but don't pick it, especially. Yeah, you're like, but I want to, because again, there's like so many follicles in a row that you can actually spread that bacteria. There's an actual form of acne called acne mechanica, which basically causes that to happen. And the last thing is keep it super hydrated. Hydrating B5 gel, Metacell Renewal B3, those are going to be key. And then also think, you know, does your hair touch your face a lot? You know, do you wash your face last in the shower to make sure like all product from your hair product doesn't get in that area as well? So I would say, you know, be persistent, exfoliate, wipe down any kind of excess oil, treat for hydration as well.
Awesome. Sort of in that vein, I know that, for instance, I'm half Jamaican. And so even if I get just the smallest little breakout, it's all about PIH, post-inflammatory hyperpigmentation. So I know we talked a lot about like minimizing the acne from even coming out, but what should we do after we get it? Because we're going to.
It's so very tricky, especially when your skin has, like, when you have skin of color, it's a little bit trickier in the way that it manifests on the skin. Like, I'm so fair that if I have a breakout, you can't see it. But if you put me under like a UV lamp, you could see it. Whereas in skin of color, that color comes to the surface, it's more apparent. And a lot of it has to do with the fact that in paler skin, we have these enzymes that break down the color as it goes through the skin, and the skin of color has less of these enzymes, so more color can get to the surface. So the biggest thing when you have the PIH, that is a very, very common element, is to always treat the inflammation. And and one of the biggest challenges is picking can do that. So that's why we also don't recommend picking. To treat post-inflammatory hyperpigmentation, definitely you could still use the Silymarin CF, or you might, if the discoloration is a real challenge, Phloretin CF, and then our product called Discoloration Defense, which I just happen to have right here because I guess you were going to talk about it. And what's really amazing about the discoloration defense, and this is one that Dr. Schlesinger loves and talks about it all the time, is because discoloration defense has an ingredient in it called tranexamic acid. And tranexamic acid, what it's designed to do is to stop that inflammation from kind of, or that blood flow from perfusing to the skin. Because basically when you have a lesion, the skin thinks that there's trauma there. So it's constantly trying to pump blood to that area to kind of correct that issue. The challenge is that those blood vessels are going to stay open a little bit longer. So by utilizing tranexamic acid, you help to just bring down that redness that's associated with the post-inflammatory hyperpigmentation. So that's going to be the first step. Then it also has kojic acid, niacinamide, as well as HEPAS, that also are going to target that more stubborn discoloration. And what's really great is that we just did a study with discoloration defense on what we call Fitzpatrick 5, which is that darker skin color. And we had like an incredible, like 84% reduction in post-inflammatory hyperpigmentation. The one word of advice that I would give you is that it takes a little bit longer, unfortunately, to treat post-inflammatory hyperpigmentation on skin of color because it's a little deeper in the skin and it's going to take a little bit to see results. If you have really persistent, you could also do, I have a friend, she's a darker skin, she's Filipino, and she pigments really, really easily, specifically after deeper peels. And she's been using the discoloration defense, and she does a layer of the advanced pigment corrector, which is another product from SkinCeuticals, and does like a double duty, and it's completely broken up those, she called them continents, but they're now becoming islands of discoloration.
Oh, nice. So she's making progress. That's great.
Exactly. So I would start with that. And then the other thing too is that, a sunscreen, because regardless of how that PIH got there, sun is always going to be a catalyst in it. So you really do need to use a mineral-based sunscreen to really reflect that light.
Okay, awesome. So we've got, acne does not discriminate, right? Like, no. It does not matter. It does not care what kind of skin you have. So we've talked a lot about this, but could you just like summarize and give us a quick dry skin, maybe rosacea prone skin, and oily skin? Here are the things and this is the order we put them on in. That would be great.
Sure. So let's start with more of that sensitive, sensitized type of skin. Okay. And when we have this redness and this irritation in the skin, all we really want to do is soothe and calm that, first and foremost. So my best word of advice for anybody who's got that sensitive or sensitized or that really red, ruddy type of skin would start with Soothing Cleanser. Soothing Cleanser is a really nice, light foaming cleanser. I like it because I don't normally have the ability to use a foaming cleanser because I don't really have a lot of oil to my skin. So they tend to dry my skin out, but the Soothing Cleanser is incredible for helping to give you a little bit of foaming action and also soothe and calm your skin. If you're new to antioxidants and you have that sensitive or sensitized type of skin, I'd actually recommend that you start with Serum 10. Serum 10 is one of our first generation of antioxidants that we have, and it has the 10% L-ascorbic acid and the 0.5% ferulic acid. So a lot of times we tend to recommend that to your more sensitive or sensitized type of individuals. And then of course, hydrating B5 gel, because when you have sensitivity, you tend to have dehydration. That's going to be one of the challenges. And then lastly, I would say epidermal repair. Epidermal repair, you've got your beta-glucan, which comes from oatmeal. It's going to help to really bring down any itch associated with your skin and also help to soothe and calm. Whereas then you asked about dry skin. Now, dry skin is a loss of oil. So in technical terms, we call it alopeoid, that you're not producing a lot of oil. So when you have a drier skin, you want to use more like nourishing types of products. Like instead of a gel cleanser, maybe a milky, creamy cleanser, like gentle cleanser. Sure. E Ferulic is going to be perfect because of that vitamin E that's in that product that's going to give you that nourishment. You still need hydration, so hydrating B5 gel, but then instead of maybe something like epidermal repair, maybe you need to go something with a little bit more of a lipid quality, like triple lipid restore 242.
Makes sense.
Okay. And then what was the last one that you asked about?
If someone's oily.
Oily.
Yep.
Oily skin, again, you're going to want to balance that oil. Mm-hmm. And so that way you might want to go with more of a foaming gel cleanser like Simply Clean or purifying cleanser that have that gel base to them, but also have just a little bit of gentle exfoliants in them. Oily skin, we already know the perfect antioxidant for oily skin is going to be Silymarin CF. But then we also want to make sure that we address hydration. And as you can see, I'm all about the hydration here. So you still need hydration with hydrating B5 gel. So you could have acne or oily skin, but you can still have dehydration. You can still have that flakiness and think that your skin is dry, but you're actually lacking a lot of moisture. So we just want to put a lot of moisture back into the skin. And then for more of an oily skin, for a moisturizer, I would still also think Metacell Renewal B3, just because of how light of a viscosity, it's oil-free as well. And then for a sunscreen, if you really want to absorb that excess oil, Physical Matte UV Defense is a great mattifying sunscreen that will help to, it's a beautiful mousse-like texture as well. That's going to be great for giving you sun protecting factor, has a tint to it, but it also mattifies the skin.
Awesome. That was so helpful to just break it down into 4 or 5 really easy steps, and you don't have to try to think too hard
No,
to get
exactly.
there. So those combinations are awesome. So we are getting ready to wrap up. That time, I have to say, went really, really fast.
Really fast.
It was a lot of information, and thank you so very much for that. I think we did get to all of the chat questions and the Q&A things. So thank you all so much for your incredible questions. They were really thoughtful. But every once in a while, new questions come up. So if in the course of the next week or something, you want to revisit this particular presentation because you remember, oh, I remember she talked about that regimen, but I don't exactly remember what it is. We are recording this session and it will be available sometime in about 24 to 48 hours. So you'll be able to access it, share it with your friends, go ahead and get it out there because there's a ton of great information in here. And then I would also invite anyone at any point to contact our customer care team. Anybody on our care team is great. You can also talk to if you want to direct it to me, Natasha at LovelySkin, you can do that too. And we will make sure that you get the info that you need and can even put you in touch with Gretchen and her team to be able to answer any specific questions. So this was amazing. I know that our team put the customer care contact email address in the chat. So if you need that there, you can certainly access it. But in the meantime, any last parting words of wisdom from you and your, I don't even know what word to use. Like, I want to say extensive, expert, there's all these words, experience. Anything you want to leave us with?
I'd say one of the things, if you're really trying to get, like, after the year that we've had and trying to just get back on track, start with your skin first. Skin, everybody's like dieting, exercising, start with your skin first. Once you start to see improvements on your skin, the rest falls into place. And also be patient with your skin. They do whatever they want on any given day. It is not going to make sense. It is not going to be logical. Things happen.
Yeah.
So just note when they happen. Keep a skin diary, especially if you have acne prone skin. Keep a diary of your skin. Find out when it falls out of balance the most, so that way you can understand your triggers. And also just take care of yourselves. Practice self-care. Be selfish. Take a bath with a mask on and a glass of whiskey if you want, and listen to Sade and just Calgon take you away. Just take care of yourselves.
I love
Absolutely take care of yourselves.
That's fantastic. Thank you so much. And thank you all for joining us. Let us know if you have questions, but man, I learned a lot and I'm really, really excited to try the Silymarin. That is like right up my alley. So
you're going to love it. You're going to love it.
I can't wait. All right. Well, thank you, everybody. And thank you, Gretchen and team. For those of you behind the scenes, we have an awesome team. Adele and Natalia and Brittany and Carolyn and Ashley have been amazing. And we couldn't do this without you. So thank you all so much. And I hope you all have a wonderful evening.
Thanks. Have a great week. Bye.
All right. Thanks, Gretchen.